Today I'm going to be talking about anhedonia. What is it? How do we treat it? What do we do about it? Anhedonia is, the overall definition is reduced ability to take pleasure in things that you used to take pleasure in or have interest in. For example, you used to like to go on walks with your dog. You don't really feel the interest, the motivation. It doesn't bring you joy anymore. You used to like to play soccer. Doesn't really bring you joy. You don't really take interest in it anymore. So things that you used to find enjoyable, not really bringing you joy anymore. 75% of patients with major depressive disorder have some kind of anhedonia. It is associated with things like impaired decision-making, low energy, but also it's not just implicated in major depressive disorder. Patients with schizophrenia, bipolar disorder, substance use disorders also have some form of anhedonia. It's just the most common in major depressive disorder. So anhedonia is associated with overall severity of the depression and also the duration that the depressive episode lasts. So like how many months it's going on for. And it lowers the level of social functioning, your ability to take part in these social functions, and it leads to an increased likelihood of social isolation. So what this means is anhedonia is not only a really important marker of disease severity, but it's also a really important treatment target. In the Journal of European Psychiatry, they did something called a logistic regression analysis. And so what this means is it looks at the probability of events occurring based on independent variables. So what does this mean? So what they were showing was 95% of patients that were in functional remission from their depression were also in functional remission from the anhedonia. So this means that just this one symptom of the depression drastically increased their chances of being functionally remitted from or having relief from their depression. And it also was highly correlated with improved psychosocial functioning, the improvement in anhedonia. So a little bit of neurobiology of anhedonia, not going to be too garrulous here, but the Journal of Friend Psychiatry shows that there's reduced dopamine in the ventral striatum during reward processing. Also, the severity of the anhedonia was associated with lower GABA levels in something called the ACC, which is the anterior cingulate cortex. So there's a lot of different treatments that help target anhedonia. Here's just a few of them. Vortioxetine or Trintellix, Wellbutrin, it's an NDRI, norepinephrine dopamine reuptake inhibitor, SSRIs like Lexapro, Prozac, Auvelity is an NMDA receptor antagonist, and the two that I'm going to talk about a little bit more is ketamine and something that's kind of a drug that's in the works in clinical trials called adacaprine. For example, the Journal of Affective Disorders showed an improvement in anhedonia and a decrease in overall depression scores after 3 or 4 infusions of ketamine. So adacaprine is something called a kappa opioid receptor antagonist. So we basically have this system called the KOR system, right? So remember that. So we have our exogenous opioid system. So what this does is it plays a really important role in cognition, mood, behavior, reward, etc. So when we experience a high level of stress, this elevates this KOR system, right? So the best way to treat it is to treat this elevation of stress, anxiety, etc. with something called the KOR, the kappa receptor antagonist. So this blocks the effects of that stress on that receptor. So this leads to anxiolytic and antidepressant effects. So adacaprine, that KOR antagonist that I just talked about, still under development. Possibly we'll have FDA approval in 2025. We'll see. The studies look promising. But adacaprine as an MDD adjunct overall showed significant reductions in anhedonia compared to placebo, and also statistically significant reductions in depression severity. So overall, anhedonia, very common. Current research is elucidating the role of aberrant neurocircuitry and neurotransmitters in anhedonia. However, there's a lot of hope in this because there's so many treatments and treatments under development for this condition.